Hi, everybody. Thanks so much for joining this Community Health Worker Roundtable discussion. Today, a very special session. After a slight detour into the world of COVID and the delays that provided, we have here Kandis Draw, Community Health Worker Extraordinaire. Kandis, thanks so much for joining us. Tell us a little bit about yourself.
Hi, Dan. Thank you so much for having me. Thank you. So I live in Chicago. I work for JourneyCare, which is the largest nonprofit hospice palliative care provider in the state of Illinois. We cover 13 counties, and we do palliative and hospice care for adults and children. We also have a national veteran services, and we offer bereavement services for anyone that's on our care. I am a contributor for caregiving.com, the website. I wrote about National Black Family Cancer Awareness Week in June, and then I just recently am waiting on another article to come out on compound caregiving, when you take care of more than one individual.
Fascinating. I think a lot of folks that are listening to this will say, wow, community health workers, hospice, palliative, that's not something I've often heard much about, which is part of the reason why we wanted to get into this with you. Walk us through a little bit of what your day work, what's the type of engagement, services, et cetera, that you have with your clients?
So, community health workers, I want to say grassroots people, because it's not just, patient interaction. It's also, making key community relationships. Working with JourneyCare specifically, because we deal with a lot of hospice, but because we deal with hospice and palliative care, I sit on an IDT team, which is an interdisciplinary team. Doctors, nurses, social workers. So I would say that I am the person, the liaison between the team and JourneyCare. So any community resources that, if that could be housing insecure, that could be food, that could be, something as simple as, tell me where the nearest grocery store is, things like that. That's where I come in and I step in. Sometimes community health workers also help with the language barriers. Some families are not very comfortable with doing hospice and palliative care. So sometimes they need it explained to them a different way. In JourneyCare, there are three community health workers that cover the Latinx part of the city. I'm the South Side rep, which covers predominantly African American, and then my other coworker covers the northern part of the city, which is very more diverse. We, in our day-to-day interactions, we have a lot of different experiences. I also give presentations on cancer disparities in minority communities, as part of advocacy work that I do as an associate board member of Gilders Club Chicago. And I found that it could be difficult to people, because of the healthcare system, maybe the distrust that's been there, and also just experiences that people have had. People aren't always quick to revert to hospice or palliative care, if that makes sense.
Yeah. And so then it sounds like when we have a community being reached, a disenfranchised community that through years of dealing with an untrustworthy health system, now in their most vulnerable moment in life, need to find trust, the role of the community health worker seems to be all the more present and important. Tell us a little bit about your experiences with that.
Well, at the moment, I have had maybe one or two experiences. I've attended a lot of health fairs in the community in Inglewood and in Chatham, where I've distributed information and talked to some people. Usually, most people that I've never heard of JourneyCare. Some have, some haven't. but they're more on the whole, can we be trusted side. And I always mention that, you can look us up as an organization. If you know someone that has been on our care, try get some resources from that, see how they felt that they were treated, different things that, they may have gone through, or um, what positive experiences they had from hospice
Mm,
and palliative care. I also have to explain the difference. So in my community education, I always explain there is a difference between hospice and palliative care. And most people don't understand that there is a difference. Palliative is if I'm diagnosed with a disease, and and it could be that's for comfort care. It doesn't mean that I'm fatal. It doesn't mean that I'm dying.
mm,
Palliative care means comfort care. Whereas hospice, okay, you have the doctor gives you less than 6 months, the doctor gives you less than a year to live, and then you need to be moved to hospice care. That's different. So, you know, I've often found that when I explain the difference between the two, more people are more prone to say, okay, see, I didn't know there was a difference. Thank you for educating me on that. And then it goes from that to um are there any other resources you can give me? Because we do also a presentation on the 5 wishes advance directive. Again, something in minority communities you don't not that we don't how do I say this? Not that we don't know what they are, but very few people have them. And so we do education around the 5 wishes, which focuses on your entire end of life care versus do you want to be resuscitated or not? Does that make sense?
yeah. It's an incredible time to be speaking about, because we're now on hopefully the tail end, who knows, right? But of a pandemic that has completely sort of redefined the healthcare delivery landscape. And we know that
Mm-hmm.
it proportionately affected impoverished communities. It reminds me of a colleague who works in Haiti with a project named Zami La Santé. And he wrote a poem called The Busiest Man in Las Cobas. And the
Hmm.
busiest Las Cobas was the undertaker, because there was so much unnecessary, disproportionate death, and also a health system that wasn't entirely trustworthy. But the idea, he himself is a physician, the idea was to try to build trustworthiness, and community health workers were the fashion that you're describing, were a big part of this.
Mm-hmm.
What are some of the best and or hardest parts of your work?
That's a great question. Hardest parts of work is, talking about death and end of life, that can be draining.
Mm,
That's not a subject you wake up in the morning and decide, hey, let's talk about, how we're going to plan our end of life. That's something that you just automatically out the door are trying to do.
yeah.
That can be difficult too. I've come across individuals that are, oh, I don't need this right now. I'm not really interested in this because I ain't dying. I don't need to be bothered with this. And it's true. And often when I give presentations on that, I always mention that this is a very hard topic. This is a difficult topic. If you approach your loved ones with something like this, give them room to process.
Mm-hmm.
Don't just say, here, you need to do this. Give people room to decide for themselves what they want to do. Our 5 wishes document gives people control. you
Mm-hmm.
know um the history behind the 5 wishes is, Mother Teresa, she had a home for the dying,
Mm-hmm.
and there was a man there, his name was Jim Toey. He was a lawyer and he worked at her home for the dying for a number of years. And there were so he experienced and he witnessed so many fights between families who were fighting about how the type of care we're going to receive. We're fighting about, mom wanted this, no, dad wanted this, well, we decided this, but no, he didn't want that. Like, so because of all that fighting, he decided, him along with some other doctors and lawyers, they decided to create the 5 wishes document.
Mm-hmm.
So I just think that talking about death in general is hard.
Mm-hmm.
um yes, something that's needed. Yes, we all have to do that eventually. It's just not something that you want to do or you want to think about. So, that's one thing, part of my job. I would also say that in minority communities, more specifically Black communities, because end of life and religion and spirituality play such a big part with us,
Mm-hmm.
it can be hard to do that because again, medical mistrust. I'm sure I don't have to tell you, just even around this vaccine, the medical mistrust about how people feel about nursing homes and comfort care, period. Some people just don't trust it.
Mhm.
And in minority communities, we're less likely to have our loved ones in facilities and things like that because it's just not something that we're comfortable with. So getting people to open up to the idea that, hey, this is helpful and not harmful is taxing too. Community health work, because it's a grassroots thing and because you have so many face-to-face interactions, you meet all kinds of people from all kinds of walks of life. um and I found that in minority communities, once trust is established, then it it brings about a better way of communication. I recently did a presentation through with Toyota Health, and one of the conversations that we had was, that I spoke about, African Americans end of life and different things like that. And there was a study done at a hospital in Georgia where African Americans were also, if they were terminally ill, they were always talking and sharing their end of life experiences and even their spirituality. But they didn't do that unless they were able to trust their healthcare providers.
Hmm. And what do you think are core lessons that you have learned from years of being on the front line at this interface of medicine and spirituality and injustice in the US health system? What have been some of the core lessons? If, say, a community health worker or a community health worker leader was listening to this right now and said, we need more of this, and she's obviously such a passionate leader for this, what would you tell them?
Well, first of all, I would thank them for, being community health workers, because it's not it's not an easy position to have. Um, I often say you have to be a certain kind of individual, because when you deal face to face with the community, you really have to be a people person and be willing to listen and sit down and collaborate, do things like that. And that, it's just not for everybody. So first of all, it would be a thank you. But the second thing would, um, lessons that I've learned is to be patient with people.
Mhm.
Um, Emphasize to people that I am not telling you what to do. I am giving you information for you to make an informed decision. I found that when you put things like that, people are more happy to then hear you out. When you put it from when you go to people, we're like, this is something you better do or else this will happen. Okay, there are pros and cons, but I think how you communicate with people is really, really key when you do community health work. Also, just open to the possibility that you may have some people that may not, as I've learned some lessons, you may have some people that don't really want to hear what you have to say, and that's okay too.
Mhm.
Again, it's in delivery. We have choices. We can make them, no pressure.
Right.
But I've learned that people really like, when you can sit down and talk to them from a real perspective. Um, I've gotten feedback that talking to someone that's community based is easier than talking to a healthcare provider.
Mhm.
It's another lesson that I've learned. You, I also think that community health workers, I don't want to say the new social workers, but it feels like it.
Hmm. We'll say more about that. Um,
Well, when I say more like the new social workers, I would say a lot of, I think what we do is similar
hmm.
interactions with people, the public, resources, dealing with families in different situations. I mean, I can say that some of the work is similar, not exactly, but it can be. Any type of grassroots work is social work, in my opinion. Um, of course, it's not the same thing per se, but when you are dealing with community and resources and bridging people together, when you're doing all of that, that's community based. That is social work,
Hmm.
in my opinion.
And I think that especially approaching it with this level of deep respect and humility, uh,
Yes,
I would say, that would be better to see in clinic, hospital based people too. Perhaps there are lessons here for the entire healthcare system. Um,
correct.
and the question is, how do we get that into the rest of the health system. You know, a lot of times we often say, what are community health workers going to do for us? You know, in terms of care delivery or the way patients and clients are behaving. But the truth is, how can we really partner and learn from community health workers in deep ways that could maybe perhaps help heal some of the biggest problems in the US health system? Talking about,
Because community health workers, you would if how do you provide culturally appropriate health education,
hmm,
giving people care they need, counseling, guidance, different things like that. So, again, that's something that's key. Some people don't have that. I would say something along the lines in the hospital, if we had to say what would their version of community health worker be, like patient navigators, things like that.
hmm. Now, I think that a lot of times people go into different fields for different reasons. And you're in a very unique field, community-based palliative and hospice. A lot of times people choose their fields because of personal experiences, because of a certain calling. What brought you to this work?
Well, I always was doing this work. I started doing this work some years ago. So, first of all, I'm a grassroots type of person. I would say I'm a grassroots type of girl because I like interactions with people.
Hmm.
I like talking to people. I love going to fairs and learning information and distributing information, especially if it's helpful. My mother died from cancer, and after she passed from cancer, I decided to become a volunteer just so that I could see for myself what, how beneficial it would have been. So I started volunteering with the National Ovarian Cancer Coalition, the Illinois chapter, learning about what all work they did, how they did it, and you know who was affected and why. And I ended up being on their run walk committee that I still am on, but I was on for it'd be about 3-4 years now. And then going from that to being a national advocate, learning about how cancer advocacy work is done at the national level, learning, sitting on boards, just learning and absorbing a lot of information to where information that I could take and really move forward with. So I would say that volunteer work is something that I love to do. It's something that I'm passionate about, and it's something that I'm good at. And I guess from there, I decided that, when at that community health work was something that I could really be successful in, something that I could really grow in. I think it's fortunate when you can say that you're doing something that you love, advocacy work. And again, this is what I love to do. Community health workers is also an advocate-based position. You're advocating for hospice and palliative care for your organization, but you're also educating people about different community topics and different things that will benefit them and their loved ones. Advanced care planning, things like that. Something that I like doing is something that's practical and that a lot of people aren't familiar with. So I figured that it was a good thing to get involved in something that capitalize my strengths.
And how do you find continued strength in doing this tough work?
I don't know. That's you know what? That's a good question. I when you're doing any type of community-based work, to not stretch yourself so thin, you really have to say no a lot. You can't be on every committee. You can't speak at every event. You can't do everything. And it's okay to say that. It's also okay to take time, but it's also good to have
Mm,
mentors that help you. I think that if you're fortunate to walk away from a position or you meet people and you have that constant guidance and in life about things, you can better navigate. So, having mentors are good. Having people that have walked the path that you're walking is good as well to help you learn more about other opportunities that are available to you or that just things that, will enhance your work as a community health worker. But really, because you do a lot and you help a lot, it's okay to say no once in a while. Take a step back, and that renews your strength.
mm. And who are the natural mentors of community health workers? Other community health workers, other clinicians, community leaders? What's been your experience?
Well, my mentors are people who have not just done community work, but people who are in public health, because it's so similar. Um, Experience with working with communities and grassroots program, which I've found a lot of while I've done my advocacy work, and a lot in community organizations. Learned that it's really, really a craft, how you deal and talk with people, and how you bring forth information, and my mentors have also have always given me a different perspective, different way of how you can go about getting things done, and that's something that I'm really appreciative of. And I think it's something that I'm very lucky to have that not everyone has in their career and as they're going on. And after I had a late start in my career because I had other family obligations, things that I was doing, but to have the two mentors that I do have that are pushing me in the direction that they're pushing me, I would say I'm very lucky.
And I'm sure that those family responsibilities were themselves training for what brought to this work.
It was, and also, during the pandemic, I worked at a homeless shelter. Chicago, during the pandemic, decided to open up homeless shelters at different locations throughout the city using different YMCAs and different park districts. So I was able to work at a homeless shelter for about 9 or 10 months during the pandemic. And that in and of itself was trying. I mean, I I tell people that's not for everybody. Everybody can't do that, and you meet all kinds of individuals that are people nonetheless. You know what I mean? People that may have had different situations or circumstances. You don't know all stories, but that's definitely I can say that was definitely something like a stepping stone to what I'm doing now.
Mm.
Um, I, along with working there, was very, very humbling.
Mm.
I ended up, and not only do you have people that come through there every day, I saw a lot of drug overdoses. I saw a lot of different things that happen, in homeless shelters. But you know, I I don't regret the decision.
Mm-hmm.
And when we talk about stepping stones, that was a stepping stone for this position. I mean, I see that now. Um, I was affected by COVID at the beginning of last year, so um, working there, I really learned a lot.
Hmm. And yet, despite seeing what was probably at times incredibly difficult, it seems that you have generated greater compassion and sort of a deeper understanding of the social forces that lead human beings, which could be any one of us, into these very difficult situations.
Yes, it definitely opened up my understanding, towards a lot, and you do see a lot in homeless shelters. You see a lot, you experience a lot. Um, I mean, I learned about human compassion, but I also learned that you don't know what people's specific situations are, and not that it's anybody's business, but
Mm.
that you who's to say if something didn't happen to you, you couldn't end up there or something, do you have anyone to turn to? Do you have any, support system? You know what I mean? It could be humbling when I sit back and I realize, okay, who that could have affected anyone close to me personally that I knew, or what if I did know someone that went through that? It's just, I think that when you're a blessed person, you take a lot for granted. And
Mm.
to see that, everybody may not have access to the same resources that you have, or even be able to to bounce back as quickly, I just learned that that situation taught me that people are still people at the end of the day.
Mhm. So it's obvious that we need more in the way we deliver care and the way that we approach the vulnerable,
Yes.
disenfranchised, and marginalized in the United States. What do you think is the future of community health in the U.S. context? Not necessarily only related to palliative hospice care, but in general.
Well, I hope that community health workers can be something that is known more across the United States. Understanding that, sitting on the team, they have a significance. Um, Not only do you provide, a lot of guidance on health or, community needs and, you know, um, I think sometimes a lack of funding, lack of infrastructure, stuff like that can affect community health workers and their scope of practice.
Mm.
I think that when you hire community health workers or have them for your organization, you should hire people that really know and understand the values and have had grassroots behavior, who have had grassroots experience, who have a passion for a certain type of work. I think that community health workers are. I think it's global, and I think it's something that's up and coming, that is booming. I really have a respect for it, and I think that you could be effective um, at your job when you like it.
Yeah.
And you have to be as a community health worker or a patient advocate or anything, make sure that you understand the population that you're serving. That's
Hmm.
another way the community health workers in the global sense will understand and know that, we have a very significant role in the way that public health is going and that
Hmm.
the way public health is being shaped.
Similarly, folks who are developing the architecture for community health programs have to recognize that a big part of that is also who we recruit, who we
Yes.
who we mentor for long-term retention, which sounds like your bosses were very good at this.
Oh, thank I'll pass the word on.
Reference applied, but the question though is, not all community health are built as well. Sometimes community health workers are seen as, cheaper care options for people with lower reimbursing
Mm-hmm.
programs, and
Mm-hmm.
this gravitational pull to hyper medicalize the model, to move away from, I think, some of what you're describing, which is a not easily reimbursable procedure, right? The application
Yes.
compassion is not the same as removing a mole. And yet the United States health system has a hard time dealing with interactions that perhaps are iterative and long term and
Correct. Yes.
engagement, not just the physical manipulation. So, what do we do to protect community health and community health work forward? How do we prove the value of the work that we do?
I think that means fighting and talking to state and congressional leaders. Explain it, like part of the advocacy work that I do for the American Cancer Research Alliance, pushing forth bills that fund ovarian cancer and cancer research. You know, any bills that are coming along that are global health, making sure community health workers are put in there, making sure there's funding for them, making sure that they have, what they need. That I think that's more of a Washington, state and center house leader, issues, like making sure you talk to your to your leaders and making sure that they understand the significance that community health workers have.
Mm. So let's say you had a audience with a top maker that was going to liberate funding for community health. I know this is kind of on the fly, but what would you tell them? Say this program needs following in order to be successful.
Community health worker program needs to be. What did you say
Yeah.
now?
Yeah. So, if you were going to speak to a policymaker that has
Mm-hmm.
some of the levers that were going to affect the life and of how a community health worker implements their work, what would you ask them for?
I think that I would need to do research on why community health workers are important before I even approach anyone.
Mm.
I would say that one of the things that I would talk about is how important we are to underdeserved communities
Mm.
and how not to forget about, those who maybe are undocumented, those who may not have access to care, those who may need some guidance. I would come from that area as a person of color, as a woman of color. That's where I would start. Um, you know, if you, and then also talking about experiences that I've had while working,
Mm,
talking about why culturally appropriate health education is needed,
mm,
how to communicate with people at a certain level, why that's important. I mean, if you want more patients, if you want more, and if you want more people of color to even participate in the clinical trials or participate in different things, you have to be able to come and speak to them appropriately. And a lot of a lot of that is not done. And I
mm.
don't want to say it's not done. A lot of people just don't know how to. So that's another significant role of a community health worker. You training, care, becoming experts on certain things. Like, community health worker is broad. So for me, it's hospice and palliative care. But for some people, it's asthma. It could be any disease. It could be diabetes education. It could be cancer education. And specifically talking about different patient groups and why you need it.
Mm.
Tools and training and strategies, all of that is needed to properly um, educate the communities that you serve.
And
And because of that, because you need to have to do the education and different things, funding is needed.
mhm. I've noticed that now in the post-COVID context, there is new money in community health, and more than in U.S. context, and even abroad. And those of us who work in community health have a unique opportunity, a historic moment. I would even go as far as to say, and in a way, we kind of have to do it right.
Absolutely.
One of the big questions that often comes up is community health workers are really dual workers. They have community work and they have health work. And so sometimes they're embedded in what they call CBO, community-based organizations. Sometimes they're embedded in health organizations. And yet, in a way, because they are the bridge between community and health system, they can get stretched quite thin. I
Mm-hmm.
of like as if a community health worker is standing on two rafts and then
Mm-hmm.
separating. And can that community health worker do a James Brown split right now? That looks kind of,
Yeah.
so the question is, what are your thoughts about where community health workers should be positioned? How can they be positioned best so that they can do their magic and not get split?
Well, in order to not get split, you have to have enough covering your healthcare system. I think that yes, you can be stretched thin, and you can be stretched thin quite quickly.
Mhm.
Which is why funding is needed and money is needed to help fund and support other community health worker positions, and also so that you don't get so stretched thin, so that the work is delegated appropriately, I should say.
Mhm.
And if you have an equal amount of staff and you have people positioned where they can make a difference, then it won't be so hard on just, I guess, maybe two or three people. You can have community health workers that can cover different things and different topics to place them in hospitals or clinics, which is, depending on how big the hospital is, should depend on, what community health worker is covering which section. You're over gastro, you're over um, I've seen where they've had community managers that have managed other community health workers
Mm.
so that the work is distributed properly. I think that for a lot of organizations, some are just starting out, learning and understanding, because as you said, I've seen a lot more community based positions lately.
Mhm.
And this probably is because there's funding is out there now that, you can do more. Organizations can now do more and understand what the community really, really needs. I think it's important to ask community health workers to, let them have a seat at the table to discover what's going on in their communities, and how, as an organization, they can best have a presence. Um, but that takes time, it takes training, and it takes funding.
That's fantastic. I totally agree. And For our listeners, there is a website that works to help train community health workers with free online trainings on how to be advocates in the vein that you're describing. It's chwadvocates.org, and there's a free online course there. Um, I don't make any money off of people clicking on this website, so no conflict of interest here. I just know this group. I've participated in help creating some of these materials. And speaking exactly like yourself, when we give voice and vote to community health workers, we de facto give some voice and vote to community members. Probably it's not enough. We have to continue to find ways to engage disenfranchised communities as much as possible. But this is one potential mechanism by which to do this. And it would be unfair to them to put them into a meeting where they were, overwhelmed by the context. Instead, that's why we created this online training that helps them out with that. In your own work, in working with community members, working with community health workers, do you have any stories or examples of where that voice was transformative? When leadership were able to hear either in an individual case or in a programmatic question, where there was power in listening to people that are generally not listened to?
I did a tabling event at the National Black Caucus here in Chicago. And I had an opportunity to talk about JourneyCare and talk about some of the things and some of the services that we provide. And I want to be careful when I say this, but there was every person that was there that was representing an organization got an opportunity to stand up and talk about what they were offering, what their organization, was about. And so it was the National Caucus and Center on Black Aging here in Chicago. And they had a South Side tabling fair for seniors and, for community resources anyway. I was able to talk a little bit about JourneyCare, but once I was done speaking, I sat down and there was this one particular lady that started talking to me about end of life care and asking me why would I do this, because it really doesn't make sense. This is a hard job. I feel for you. And so I asked her, well, why do you feel for me? I don't understand. And she was like, well, we ain't really, and she said, we don't like to talk about that. We're not trying to be, doing all of that. And, again, spirituality and African Americans play a huge part in this. She started quoting the Bible to me and saying how, doctors don't determine my life. I determine my life. God determines what happens to me. Nobody has a right to tell me how to live. And so I let her talk. And I said to her, you're absolutely right. I said, you're older than me, so you could probably teach me some things. I'm like, you are absolutely right. I have no right to come to you and tell you what to do or how to do it. Absolutely. You're correct. I said, but that's not my job. And she said, well, then what's your job? I said, my job is to give you education. I said, so you can make your own decision. And then she said, well, God determines my life. I said, yes, he does. I said, but God also gives us personal choices. And so she, once we started talking on more biblical level, again, you have to be careful with this. But again, I see this a lot in the community that I work in. I see a lot of this where people will say this to me. By the time the conversation rolled up, she said to me, well, I like how you are and some of the things that you said to me. She said, and I'm glad that you understood what I was saying. I said, oh, absolutely, I do. And she said that, so she ended up taking a lot of information. And she said, I'm going to look through this and I'm going to feel this out. And she said, I probably would not have done this if you hadn't said something, if I had to come here today. But I'm glad that you explained this to me. And so I said, well, I'm glad that, you made a decision. Now, I don't know if she ever did or I don't know what the outcome was of that. I just know she took some information and she decided in what she told me verbally.
Mm.
But that's just an example of what I've experienced. When it comes to matters of spirituality in minority communities, something you have to be very tactful about. And I see it all the time where, God didn't tell me it was my last day here. And God didn't tell me, I'm not in a position to tell anyone how to live. I'm just here to just give you information. That's it. And I listen, and based off the conversation that a person gives me determines my response. So
The story is fantastic because I think what you're modeling there so beautifully, something I wish all medical trainees could really learn and embody, which first share power by demonstrating your listening deeply. Right? How many people disrespected by doctors and other frontline care providers,
correct.
unlistened to? You didn't do that. You
No,
first you recognized her power, which was one of a wealth of wisdom from age, from experience. You allowed her to speak her truth, and then found a common ground. Isn't that a model for the way we can not only heal big part of the health system in America, but maybe America itself?
absolutely. Yes. Yes. And, realizing that we can't rewrite what history has done.
Mm,
Not saying that, not to make it anything less significant because those were some hurtful times, but knowing that going forward, that as a healthcare provider or someone that is on the front line, it is your responsibility, to not just represent your organization properly, but also to make sure that you understand, where this person is coming from. Understand you can't change everything, but your delivery and how you are with them will determine a lot of different things. So yes, that bedside manner, be again, community health workers in culturally appropriate situations. Yes, absolutely.
mm. Dennis, we're coming up on our time together. I've learned a ton. I'm deeply indebted to you for teaching me so much.
Oh, thank you.
I'm trained as a physician, but I often say that I wish I was a community health worker.
Mhm.
Wish I was able to embody the space as expertly as you guys do. Any final thoughts before we part? Anything that you want our listeners to leave here sort of chewing over?
Just about more how you can increase the community health worker awareness at your own um, prospective employers. Um, to really be transparent and just tell them exactly what you're seeing in the communities and what you feel will benefit.
Hmm,
And also letting people also just understanding that, people are people first.
hmm,
And if you talk to people in a culturally appropriate way, you'll get further with them. And um, and that is a very, very critical work that community health workers do.
hmm. Critical
And
work.
how we should all be proud.
Yeah. Amen. Amen. Critical work at a critical time being
Yes,
by, by deeply thoughtful natural caregivers. And in your case, in some of the most intense moments of a person's life. I think we're really lucky to have folks like you and your team at the front lines and teaching us the rest on how to do this.
absolutely. Thank you. It was good to talk to you.
Thanks, Candice. And I think folks are going to get a lot out of listening to this. So
Great.
that's it. Roundtable discussion with Kandis Draw. Thank you.
Thank you.